We are joined today by our moderator, Marie LeGrand, Director of Education and Healthcare Relations and Grant Management with the Multiple Sclerosis Association of America, and our speaker, Dr. Jacqueline Rosenthal of the Multiple Sclerosis Institute at Shepherd Center. At this time, I would like to turn the microphone over to our moderator, Marie, for opening remarks.
Good evening, everyone. Welcome to the Multiple Sclerosis Association of America's live webinar with Dr. Jacqueline Rosenthal entitled Clarifying the Confusing World of Clinical Trials in Underserved Populations. I am Marie LeGrand, Director of Education, Healthcare Relations, and Grant Management for MSAA, and your host for the program this evening. We are pleased to bring you another program in the Health Disparities series in the MS community. This program is designed to bring awareness, disperse misconceptions, and help you stay informed on clinical trials. This program has been made possible through educational funding from Bristol Myers Squibb, EMD Serono, Genentech, and Sanofi Genzyme. You will have the opportunity to ask Dr. Rosenthal questions at the end of the presentation. Before introducing Dr. Rosenthal, please join us in holding a moment of silence for 1 minute in support of equality, social justice, and human rights as we honor and remember George Floyd. Thank you. I am honored to bring Dr. Jacqueline Rosenthal. Dr. Rosenthal is a neurologist at the Andrew C. Carlos MS Institute at the Shepherd Center in Atlanta, Georgia. She is a graduate of Morehouse School of Medicine and completed her neurology residency at Madigan Army Medical Center. After completing residency, she practiced general neurology at Marne Army Community Hospital, and it was during this time that she developed a special interest in patients with MS and other neuroimmunology conditions. After separating from the U.S. Army, she completed a neuroimmunology fellowship at the Atlanta VA Medical Center and Emory MS Clinic, focusing her primary research around the examination of neurodegenerative biomarkers of cognitive dysfunction in patients with MS. Outside of patient care and clinical research activities, she enjoys spending time with her husband and 2 young sons. Without further ado, please welcome Dr. Jacqueline Rosenthal.
Hi, good evening. Thank you so much for the introduction, and many thanks to MSAA and Impact Education. I am really happy to be here this evening to discuss this very important topic, and so we will go ahead and get started here. So here are the objectives of tonight's talk. I will discuss why diversity in research is so important. Also, I will review some of the latest research developments that we know of as it pertains to MS treatment in ethnic minority groups. We'll go over the important role that research plays in providing evidence for treatment, as well as guiding our decisions, our treatment decisions for quality of life. We'll also go over, really what it means to participate in a clinical trial, what regulations are in place to protect you as a volunteer in a clinical trial, and just in general, how to assess the benefits and risks of participation. Okay, so why are clinical trials important? Well, clinical trials are really what we use oftentimes as the basis of evidence-based medicine. And evidence-based medicine is essentially the practice of using the best available evidence or research that is out there in order to make decisions about patient care. And this is important because medicine is constantly evolving, and we use research and what that tells us in order to keep up. And so evidence-based medicine tells us information on the effectiveness of the various treatments so that we can make good decisions for our patients. Now, why is diversity in clinical trials so important? In order to accurately apply the results of our clinical trials to all patients, we really need to in clinical trials, we need our research studies to include patients that are representative of all patients who have the disease of interest. And in this case, we're talking about multiple sclerosis. Now, we know that geography, ethnicity, and race all contribute to disease susceptibility. So we want our participants to be from varied geographic, ethnic, and racial backgrounds. The natural history, or how a disease behaves over time, and the response to treatment may differ between different populations, and these raise certain questions. So, are there any genetic factors that may influence disease, and do all racial or ethnic groups respond similarly to treatment? And then also looking at socioeconomic status and how Access to care may lead to overestimates in disease severity. So with that being the case, we also need our participants to be from all socioeconomic backgrounds. And so, you know, in considering all of this, it's difficult to apply research results to all patients when really only a subset has been studied. And just to kind of tie this all together, you know, in order to, you know, accurately apply our clinical trial results to all patients, we have to study all patients. Now, as it stands now, when we look at clinical trial participation, only a small proportion, less than 10% of participation comes from minorities. And this is, you know, essentially our goal is to increase this number. By increasing participation, the results that we obtain will be more meaningful for all groups, minorities in particular. Now, why are minorities underrepresented? So there's several reasons that this may be the case. You know, mistrust is a big one there. There's a history of discrimination and exploitation that can weigh heavily on one's decision on whether or not to participate in research. Also, when you look at access to care, insurance may play a role. You know, based on someone's insurance, they may or may not have access to the specialists who are more likely to recruit for clinical trials, for example. And then when we look at income, you know, that is closely tied into someone's availability as it comes, you know, as it relates to time and resources, and that can also play a role. There's also language barriers, and then there's cultural and religious beliefs that can contribute to one's decision to participate in research. Now, in looking at available research on minorities with MS, as it stands now, a very small percentage, so less than 1% of the literature that is available has a focus on the Black or Hispanic Latino population. And then in looking at MS health outcomes in particular, there's very limited data available when you're looking at Hispanic Americans. And so these are just examples of the gaps in research that we are looking to address. And unfortunately, when trying to find information related to some of the other minority groups, Native Americans, for example, the information is very scarce. So what do we know now? I'm going to review some of the findings from studies that have looked specifically at minorities with multiple sclerosis, and the majority of these really have been published fairly recently, within the last 5 or 10 years. Okay, so first, when we look at the incidence of MS, there are 2 studies that were done that assessed this, and they found that African Americans have a higher incidence rate than white Americans, while Hispanic and Asian Americans tend to have a lower risk of MS. And this is important to note because there has been really a long-standing perception that white Americans have the highest incidence. And so these studies argue against that and are showing a different perspective that really needs to be further characterized. So next, in looking at differences in MS age of onset, African Americans, the literature there, there's some discrepancies where some studies show that African Americans have an older age of onset and other ones suggesting that there's a younger age of onset. And looking at the Hispanic Latino population, the literature that's available is fairly consistent that they tend to have a younger age at onset. And this is important because, you know, if you're diagnosed with MS earlier, you're more likely to display disability earlier on or at a younger age. All right, so now I'm going to talk about disease severity. So in the literature that's available right now to suggest that African Americans have a more aggressive or rapid disease course, that they have more frequent relapse, or that there are poor recovery after relapse, also potentially that there's a faster transition to secondary progressive MS. And when looking at disability particularly, there's literature to suggest that African American and Hispanic Americans accumulate disability more so than their white counterparts. And so this relates to what I talked about previously as well. When you talk about differences in age of onset, if you are diagnosed at an earlier age, then it's possible that you are going to demonstrate disability earlier and then more likely to accumulate over your life. What about, signs and symptoms at presentation? So there's literature to suggest that Hispanic Americans are more likely or have a higher frequency of presenting, so, when they're first diagnosed with symptoms of optic neuritis or transverse myelitis. And this really suggests the potential for severe symptoms from the very beginning of disease. Along the same lines, when we look at optical spinal MS, now this is a variant of MS that selectively involves the optic nerves of the spinal cord, while the brain tends to be spared. Okay, I think we're good. Okay, so I was talking about optical spinal MS, and this, when we look at this MS variant, it tends to be more common among African Americans, Hispanic Americans, and Asian Americans. And we looked at, again, optical spinal MS with that involvement, selective involvement of the optic nerves or the spinal cord. Along with that, again, is the potential for greater disability. Now, differences in MRI findings. So there's literature to suggest that African Americans may have higher T1 or T2 lesion burdens. When we talk about these lesions, again, these are demyelinating lesions or kind of the spots that your neurologist may talk about to you as it relates to MS. And there may be imaging differences that are seen in other minorities, but unfortunately, we can't say for certain because, again, these studies are so scarce. All right. Okay. Now, what about neurodegeneration? So neurodegeneration is the loss of function of neurons. And compared to white Americans, there's suggestion that African Americans may have faster brain and retinal tissue loss. So in this particular study, when they measured brain volume and optic nerve volume, they saw a faster rate of atrophy or volume loss among African Americans. And this is in line, again, with our prior findings, suggesting that you, as an African American, there may be a more severe disease course. Next, genetics. So the genetics related to MS are very complex, but really, in just looking at the underlying etiology of MS, we know that genetics contribute, but are not in and of themselves solely responsible. MS is associated with a lot of different genetic variations, which can vary by region or by country of origin. And when looking at the MS-associated genetic variations, it's HLA-DRB1 expression in particular. This is the one that is most strongly associated with MS, and more specifically that which has been tied to European ancestry has been most strongly associated with MS risk. It's about 3 times higher risk than folks that don't have that particular genetic variation. And there are other DRB1 alleles that have been associated with having a higher risk of MS that have been tied to different areas, African, Japanese, Italian regions, for example, but not quite as high as which has been associated with European ancestry. So this is another really important area that needs to be looked at to find any, different trends that could further explain differences in prevalence of MS risk. So next, differences in response to certain treatments. This is an important topic here. An example has been that interferons may not be as effective in African Americans. This is based off of a study that was completed several years ago where they were really looking at the efficacy of interferons and comparing them. And once that study was completed, they went back and looked at all the folks that were in that study and found that African Americans had higher relapse rate and also had more MRI lesions compared to the white Americans. And, there's at least one other study that has suggested differing responses to treatment based on race. And this really highlights the need to include a diverse population in our clinical trials, especially as it relates to treatment. All right, now what about vitamin D? So a lot of MS patients take vitamin D. This was a study that was completed in 2018 that suggested that African Americans and Hispanics may not respond as well to higher serum vitamin D. So this is a vitamin D that they're measuring in the blood. Now, they did find that lifetime sun exposure reduced risk, MS risk among all groups. But again, it was only in white Americans that they found that taking oral supplementation provided any sort of benefit. Now, this was a small study with only a couple hundred with MS from each racial group. So it definitely, is not a definite thing, and they need additional studies to further clarify and characterize this, and does not mean that anyone should stop their vitamin D if that's what's been prescribed to them, but it's an example of why doing these kind of research studies are so important. All right, socioeconomic barriers. Now, these include things like limited insurance, access to specialty care, income, education levels, language and computer literacy. These are all important considerations when we are assessing disease course and severity in minorities. And what we found out from literature, that African Americans are less likely to have private insurance. African Americans are less likely to receive care at an MS clinic, and Hispanic Americans receive less mental health or rehab care. So these are just some of the examples that have been seen thus far. And so when we see this information, it really does suggest that, worse severity or unfavorable outcomes in minority populations are multifactorial, and there may be a large contribution that are related to healthcare disparities. What other potential differences may we see? So are there differences in mortality? Are there differences in biomarkers? Biomarkers are what we use as a marker or a measure of disease, and these may include things like MRI or lumbar puncture, spinal fluid studies, or labs. So again, are those equally meaningful amongst all different, racial or ethnic groups? Are there differences in immunopathogenesis, meaning the process of disease development? So these are the questions that still need to be addressed. Why are there differences in disease severity? Is it due to genetic differences, environmental, health disparities, a combination of all of the above? What are the implications for treatment? Do certain ethnic groups need to be treated differently based off of their race or ethnicity? And when considering racial and ethnic differences, what are the implications for accurate and timely diagnosis? Okay, so now I'm going to talk more about clinical trials. And clinical trials are a type of research study where individuals are assigned to one or more interventions to evaluate the effects of those interventions. And as it relates to multiple sclerosis, clinical trials are particularly helpful in finding new disease treatments and then measuring how those treatments work. Now, each clinical trial is led by a principal investigator, and that person will be responsible for carrying out really the entire plan of the study. There are different types of clinical trials. There are clinical trials that look at how to prevent a disease, how to screen for or diagnose a disease. Treatment trials, again, these are, I think, very important as it relates to MS, where you can look at and evaluate new treatments or combinations of treatments to see how they work. There are behavioral trials. Quality of life trials are important as well, looking at symptom management. So, as it relates to MS, this may include things like, spasticity treatment or how to better manage pain, and they also include wellness issues that we see with multiple sclerosis. Now, who sponsors clinical trials? So, who pays for the clinical trial? Pharmaceutical companies are one example of who may pay for a clinical trial. There are also different offices, federal offices and agencies that may, such as the NIH or Department of Veterans Affairs. Individuals like doctors or healthcare providers, although in this case it's going to usually be on a smaller scale. The main point that I'm making here, though, is that while sponsors may initiate, manage, or finance the trial, they don't actually conduct the research. So now I just want to go over some of the more common terminology that we see when discussing clinical trials. First is randomization. So in talking about clinical trials and how they're carried out, there are, one or more intervention group, and then there is a control group. And so randomization is really referring to the method by which a volunteer or participant is able to, or how they're assigned to one group or the other, because it should be in such a way that it's by chance rather than by choice. And that's important to avoid bias as a study is carried out. Next are blinded or masked. This is referring to the process where the members of the research team are prevented from knowing who is actually receiving that intervention. And this is helpful to ensure that the results are accurate. Now, a study can be single-blinded. This would be where the researcher knows if a participant is receiving the intervention, but that participant would not know. Or double-blinded, where neither the researcher nor the participant would know if they're receiving that intervention. Next is intervention group. This refers to the group that is receiving that intervention or treatment of interest. And just some examples, obviously medications are in there, but sometimes devices or procedures, there may be a certain diet that investigators are looking to see if it makes a difference. Therapy and exercise are other examples. And then lastly here, placebo. So placebo is of no treatment value. An example may be like a sugar pill, for example, and it's used to evaluate the effectiveness of the intervention that you're looking at. When we talk about MS clinical trials, especially as it relates to disease-modifying treatments, placebos aren't typically used anymore. There's been a lot of medications that have come out over the past few years, and for that reason, rather than the control group be patients that are on nothing or something of no treatment value, a lot of them are new medicine, maybe compared to one of the standard therapies that has been out for a while. Okay, now there are different FDA categories. We look at clinical trials, which are really carried out in 5 phases. Phase 0 is the very, very early stages of the disease, very minimal human exposure at that point. When you get into phase 1, this is where the researchers are really starting to look at the treatment, small groups of people, and the main purpose here is really just to learn about the safety. What's the safe dosage range, and are there side effects, and if so, what are those side effects? Now, as you move to the later phases, you're still looking at safety, but then you also start to focus on efficacy as well. So in phase 2 of clinical trials, a little bit of a larger group, 100 to 300, for example, and that's when they start to look at the efficacy in addition to safety. By the time you get to a phase 3 trial, there may be a few thousand people that are being evaluated, and at this point, you could really look at how that drug works in different populations, which dose ranges are the most effective, and then phase 4 trials are oftentimes performed after a drug has already been approved, just to go ahead and continue to gather long-term data. So next I'm going to talk about the clinical trial protocol. Now, the protocol includes basically all relevant information about how this study will be accomplished. The principal investigator is responsible for following that clinical trial protocol and ensuring that everything is carried out appropriately. So the protocol will outline the goal of the study, who is eligible, who is not eligible, how are participants going to be protected, all of the specifics about tests, procedures, treatments, how long the study will take, and then how the information will be analyzed. So I just want to talk a little bit about eligibility criteria specifically. This varies with every trial. It depends on what exactly they are looking at, but a lot of trials will have specific criteria for age, whether they're looking at adults or children, or if there's a specific age of interest. Some trials will look at both men and women. Some only want to look at men, and some may only want to test something in women. The type and stage of disease. So as it relates to multiple sclerosis, there are some clinical trials that only want to look at individuals with relapsing remitting multiple sclerosis, and others that may focus more on progressive. Certain previous treatment history may play a role, where if you're treated with a particular medication, for example, that you may not be eligible to participate, and then other medical conditions. Sometimes the presence of other medical conditions can have the potential to maybe affect the outcome of a study, and for that reason, certain things may be excluded or not, be ineligible for the study. So again, these are just examples, but this is something to pay attention to if you're interested in clinical trials and you're looking to see if you may be a candidate. So next, what are the expectations for research participants? Another, again, a lot of variance here, but there may be clinic visits, and the clinic visits may be infrequent or they may be frequent, and they may last different amounts of time. Procedures may be involved, and examples of this may include MRIs or blood work. Medications may be administered, or therapy sessions, for example, and questionnaires are often used during clinical trials to gather information. Okay, so next, protection for research participants. So this is important to ensure that volunteers are not being exploited. Oh, excuse me, wrong slide. Here, okay. Are not being exploited and are not being exposed to any unnecessary risk. So there are government agencies in place. These include the Office of Human Research Protections and the FDA, and they really kind of set ethical standards for research and have a focus on protecting research participants. There are also institutional safeguards, such as the Institutional Review Board, and each facility, whether it be a medical center or academic center, should have an IRB, whose job it is to review and approve studies before they can actually start. Now, as a group, if they review a study, for example, and determine that there is too much risk involved, then that study won't be approved at that institution without the necessary changes. They also review the informed consent, which I will talk about next, I believe, to ensure that it's written in such a way that patients are able to understand it without problem. And then there's a data safety monitoring board. This is a group that, while the study is ongoing, make recommendations with regard to whether or not that study should be allowed to continue, should there be any changes, or should the study even be stopped in some situations. Okay, here. So informed consent. An informed consent is really the process of getting permission from the volunteer before starting a study. It ensures that you as a research participant understand enough about the study in order to be able to decide if you would like to participate, and this includes acknowledging possible risks and benefits associated with that study. When you sign the informed consent, you're essentially indicating that you understand the research process, and you can still leave at any time, so the informed consent is not a contract. So this is just kind of, again, a review of the informed consent process and what to expect. So within that informed consent, a document, there should be a description of the purpose of the research. It should outline what you should expect as a participant. For example, what will you have to do and how long will it take? It should also go over the research, the plan of research or the protocol. It should outline any possible risks or discomforts or any benefits, and who you should contact with questions or concerns. Now, when you get that document, you can take that document home with you. You don't have to sign it right then and there. That gives you the option to read it over more slowly, discuss it with family or friends before you make a decision. And then lastly, as you're going through that document with the research team member, it's absolutely fine and encouraged that you ask questions. So now, in looking at some of the misconceptions that exist about research, here are just a few. One is that the informed consent is not a contract, so you can leave the study at any time and for any reason. It doesn't depend on anything you signed. If you leave a study, it will not affect your care, so your neurologist or your healthcare provider will continue to treat you appropriately regardless. Researchers must keep your health information private. And then with regard to placebos, not all studies use a placebo, as I mentioned earlier. They are especially not used if it means that by administering a placebo, you as a volunteer would be put at risk by not having an effective treatment. And then the other thing to mention here is that if a placebo is going to be used in a study, you'll be told about that before you participate in the trial. So you may not know after participating, if it's a blinded study, if you're receiving a placebo or if you're receiving the intervention or treatment that they're studying, but you will know if that's a possibility before you even agree to participate in a clinical trial. So what questions should you ask throughout this entire process? So again, these are all important. You want to really make sure you have a good understanding of what the research is about and what are the study requirements. You also want to really inquire as to how that research might affect you on an individual basis. When we're talking about risks, you want to know how these risks will be minimized, how will your health information and personal information be protected, are there any costs? So, the sponsor typically will cover any associated costs, but it's still good to ask and clarify these things, and especially as it relates to costs. And then who to contact if you have questions or concerns. So again, you should be provided with information so that you have someone to talk to if anything comes up. And then other considerations may just include clarifying, the expected time, duration, travel, for example. Would reimbursements be provided? That's something to ask for. And this is also when you can and should ask about if there's going to be a placebo or any sort of inactive treatment. So what about after the clinical trial? What happens then? Well, the researchers will examine the results and determine the significance of those results, and then they're typically published in a scientific journal. Once that happens, then anyone can read that and use that information. Healthcare providers can use that information to help make decisions in patient care, and that's kind of how we come full circle with that evidence-based medicine. So should I participate in a clinical trial? This is just a list of certain pros or cons that may come up. One is that by participating, you may have access to otherwise unavailable treatments or procedures. This may also be an opportunity for patients who have not responded well to standard treatments to receive something that may help. There's also the contribution just to the advancement of medical knowledge, and also as a minority to hopefully optimize disease management in other minorities. Also, there's regular medical attention from a research team. Now, this can also be considered a con, really, if you look at frequent visits that can be inconvenient for some. Other additional cons may include just undergoing additional testing, any risks involved. Also, you know, when you decide to participate in a clinical trial, you may not be part of the treatment or experimental group. And then really conversely, if you are part of the intervention group, the intervention may not work. It may not have the expected outcome. All right, so we talked a lot about clinical trials, and again, a clinical trial is where you have an intervention group and a control group, but there are other types of studies. When you look at the design of a study, observational studies are very common, and as the name implies, this is really talking about a study where there's observation only. So you're not receiving any change to your care as a result of participation. And this can provide really useful information with regard to potential risk factors or safety and treatment. So an example here would be patient registries. These are used a lot, and they are really important, especially if, as a participant, the thought of receiving any sort of medical intervention doesn't sit well with you, but you still want to contribute to research, and this would be a really wonderful way to do so. Okay, so we're starting to wrap up here. I just have some take-home points. First is that volunteers are essential to clinical trials, and clinical trials really are essential to, you know, this whole evidence-based medicine process. By participating in research, you can benefit yourself and others. Also, that research clearly suggests that there are racial, ethnic, and socioeconomic differences that need to be addressed in clinical trials, which requires adequate representation from minorities. So what about future directions? These are some of the questions that we'd really like to answer. First, what is the effect of race or ethnicity on MS disease? What is the impact of the environment? And what is the impact of genetics? So if we work to answer these questions, it will really help to ensure that the treatments that are available are impactful to everyone. Here's just a list of some of the resources that are available to learn more about some of the information that we've discussed. I really want to bring your attention to the second bullet, clinicaltrials.gov. If you're interested in research and really want to kind of see what's going on right now or where studies are being carried out, this is a good website to go to get more information. Okay. Now, I thought this was just a good example of a phase 3 trial that's currently recruiting. This is Beat MS, so they're including 150 or so adults at various sites, between the United States and the UK to receive stem cell transplant or one of the best available high-efficacy biologic drugs. And I believe they're looking at natalizumab, alemtuzumab, ocrelizumab, and rituximab. So this is not a trial that's utilizing placebo, but they're going to randomly assign participants to one group or the other and then follow them over a period of time to see how the treatment is working. And this is, again, a good example of a research study. This study will be more impactful if we have participants that are diverse. Okay, and that is the end of my presentation, so I'm more than happy to go ahead and take questions.
Thank you, Dr. Rosenthal. So we've come to the question and answer portion of our program, and the first question that we have is, should patients over the age of 65 take MS medications?
So that's a good question, and that comes up a lot in taking care of MS patients, and the answer is not straightforward. You know, it varies a lot. This is something that has to be addressed on an individual basis with your neurologist. But, you know, in some cases, just when we talk about the natural history of MS, after someone may have had it for a certain period of time, sometimes medications are not felt to be necessary, but there's not a one-size-fits-all approach. So it's possible that someone may not require a MS medication indefinitely, but it's a decision that needs to be made on a case-by-case basis with your neurologist.
Thank you. Has the effectiveness of Copaxone been studied in different ethnicities?
So I believe there was one study that looked at, I think it was Copaxone, some of the interferons, and I think it was Tysabri, where it was thought that it did not have the same outcomes in minority African Americans in particular compared to some of the other racial groups. But this again is an example of, again, one study. I believe it was a small study. So we need more research basically to draw any definitive conclusions from that.
Okay. When you volunteer for a clinical trial, would you stop taking your primary MS medication while taking the clinical trial medication, or both at the same time?
So that's a good question, and it depends. It depends what the clinical trial is looking at. If it's a clinical trial for a different disease-modifying treatment, then they may want you to stay on the same medicine. If you're on one that, you know, falls in line with what their eligibility criteria are. If it's a trial where you may be exposed to a new or different medication, they may want you to come off of it for a certain time before starting. There's a lot of variance here. So I think the biggest thing to emphasize here is that, you know, as it relates to disease-modifying treatments in clinical trials, no one would want you to be off of your medicine altogether. We want to still make sure that you're being protected in that way.
Okay. Can you post the open research companies currently available again?
I'm sorry. You said the open research companies?
Yes.
Sorry, let me see what slide.
I believe, let me see here.
I don't believe I made a slide about research companies specifically. Was this for the sponsors?
I'm assuming it's the patient resources, perhaps.
Oh, sorry. Yes. So let's get that slide back on there. There we go.
Okay. I will go on to the next question, which is, what are placebos?
Good. So yes, placebos again are an inactive treatment. So they're used to just really strengthen a study. When you are looking at a particular intervention, you have to have something to compare it to in order to see if the intervention you're interested in is effective. And so sometimes they'll use a placebo, which is really an inactive treatment. So it has no treatment value. And an example may be like a sugar pill, for example.
Okay. There is another question. Are studies done with incarcerated people? What other issues come up with incarcerated people where there is a risk of coercion?
That's a good question. So the incarcerated population is really kind of a special and protected population. There are studies being done on incarcerated people. As it relates to MS, that's not something that we see a lot, just because, you know, you always have to look at what information are you trying to gather. And so a lot of that stuff comes from the population that we have, just general population. But there are studies done on incarcerated people. And to your point, the risk of coercion is an important thing that needs to be really addressed. It's that population some extra effort needs to happen there to ensure that they're adequately protected.
I'm interested in the stem cell trial but turned 57 on Monday. Why is there a cutoff at 55 years of age?
So with that particular study, I can't speak to why exactly they picked that as their upper limit of normal. I will say just in general, a lot of trials will have a cutoff with regard to the upper age, just because in life, at a certain age, people may develop other medical conditions. And so in that way, they may be trying to reduce having people involved in the study that have other comorbidities. But again, with regard to that specific trial, I can't say exactly as to why they picked the age 55 for that study.
Okay. Since we're in the middle of a pandemic and the clinical trials have begun to find a vaccine, how long will that clinical trial last? How long do they normally last?
It depends. So one of the things that go into determining how long a clinical trial will last is how long will it take for you to get the number of participants that you need in order to see if your treatment is effective. And so, we've seen a lot in the news as it relates to coronavirus, and just kind of looking at what they need to do in order to test their intervention, which would be the vaccine. They have, a lot of people that they could potentially recruit from for that. And so I think that's what they mean when they say they can try to expedite things. There still needs to be, what they can't change, is the amount of time that is required to see if that intervention works. So you're kind of looking at two parts. So one part of the decision-making with regard to how long a trial will take is, again, how long will it take for you to get the people you need to make the results meaningful. And then the second part is how long do you need to see if your intervention or your treatment is actually going to work.
Will tizanidine help to minimize MS reactions in legs, arms, and optical nerve problems?
I'm sorry. Was that tizanidine? Is this tizanidine?
Yes.
Okay. So tizanidine is a medication that's used frequently in MS patients for spasticity, for example. It's really hard to say. Spasticity is kind of tightness or difficulty or moving the muscles. And it's hard to say how that works on an individual basis. That is something that, I would encourage you to talk about with your neurologist to see if it's something that could be effective for you.
What efforts are being made to recruit minorities into clinical trials?
Well, this talk today is an example of one effort that's being made, and I think there are many others that are, working to, other organizations that are working to provide education and address some of the barriers that are in place right now. And I'll add that in addition, I think that some trials are really in their recruitment trying to set standards to really include more diverse populations to enhance the results, to make them more meaningful.
Can you provide more information about even cell therapy?
About stem cell therapy?
I'm assuming it's stem cell.
Okay. So that is just another, and I would put it under the category of like a disease-modifying treatment with multiple sclerosis. It's not currently something that is FDA approved, but it is, as I mentioned in the example, it is another treatment that they are looking at that could be used as a standard treatment in MS patients. And more likely than not, it would replace, it'd be another option in addition to, when you think about the currently available or standard MS therapies that are out there right now.
What are some potential risks involved when participating in clinical trials?
So it depends. When you look at medications, if you look at medications that are available now and FDA approved, if you just look at the side effects, I mean, it's extensive a lot of the time when you look at all the possibilities that a medicine could cause. And so that obviously is a risk as well when you are participating in a clinical trial. And I want to back up to the slide I had on that, because other risks really could include, so another, I wouldn't consider it a risk, you know, when we talk about frequent visits and that sort of thing, that's more of an inconvenience. But another potential risk would be that you are receiving the intervention or what they're looking at, and maybe it doesn't have the expected outcome.
Where can I view the current clinical trials being offered?
So if you go to that website, clinicaltrials.gov, I believe that was maybe the second or third to last slide in the presentation, that will really, and you can search by diagnosis to find clinical trials that are ongoing right now. And it really gives a lot of information on, again, all the sites that are recruiting and the eligibility criteria. And so you can find a lot of information about clinical trials from that website.
Will my doctors be involved in my participation?
It depends on where the study is being carried out. So, you know, if your doctor is involved in the research team that is carrying out a study, then yes. Obviously, regardless, your doctor should know that you're participating in a clinical trial that may have some implications on treatment and how things are managed. But it depends on where that study is being carried out, and with regard to how involved your doctor may be.
Will vitamin D deficiency actually affect MS sufferers?
So there's, you know, and I talked about this a little bit in the slide, there may be just a little bit of conflicting literature there. As it stands, you know, what we believe is that vitamin D deficiency can impact your immune system, and that for that reason it's more favorable to have vitamin D levels supplemented to the point that they are in kind of a mid to high range. And so that's, I think, what a lot of providers are kind of sticking to at this point. But when you hear of literature to suggest that maybe certain minority groups don't respond to vitamin D the same way, it does, you know, raise some questions. And is an example of why we need to do some additional literature with a focus on looking at diverse populations.
What role do comorbidities play in the eligibility for MS trials? How much of a role do they play in the underrepresentation of African Americans in MS trials?
Ooh, that's a very good question. I think you know, that's where things kind of get complicated there. So when you look at comorbidities for MS trials, you know, it varies, but they can play a role. Usually when you talk about trials for new medications, a lot of researchers want the patients to be fairly healthy otherwise to begin with. And the second part of that question was, when you look at minorities, we know that in general, oftentimes minorities are disproportionately affected with other diseases. And so that just kind of maybe some of the underlying reasons for why a lot of minorities have been or less likely to be able to participate in clinical trials. And so, you know, I would hope that as we move forward, that is something that can be looked at a little more in detail, and maybe some concessions need to be made in order to ensure that there is adequate representation from all ethnicities and all races within our studies.
Are there non-drug trials, specifically nutrition trials?
Yes, there are a lot of studies going on right now looking at different nutrition and diet and the impact that could potentially have on multiple sclerosis. As many of you well may know, when you try to ask about a specific MS diet, there really aren't any, evidence. When we look at clinical trials studied there's not a lot of good evidence out there right now. So that's been a big area of research. And so I know we talked a lot about drug treatment trials, but there are also clinical trials that look at symptomatic treatments, that look at diet, that look at therapies. And so not all clinical trials involve taking a medication.
Okay, we're going to take two more questions. The next one, how are the mindsets of practitioners being changed to enhance awareness about the prevalence of MS among African Americans so that diagnosis and treatment are not delayed?
Now, I think that most MS specialists have a fairly good idea that, that African Americans this is not a disease of just one certain racial or ethnic group. I think it is important, though, to communicate this to other providers, whether they be general practitioners or general neurologists who don't maybe don't see MS as frequently, so that they are more aware and that it's included in their minds as a consideration or differential diagnosis earlier on. And we are in different organizations making headway here, just trying to provide education to other healthcare providers on that exact subject.
Are costs involved for the patients if you participate in a clinical trial? And I'll take one more question after this, and then we're done. Not directly, in terms of where you have to pay for like your medications or treatments or blood tests, typically not. But there are other costs that you may think of, the cost that it may take with regard to travel, taking off work, child care. So these are some of the other costs that really can sometimes play into whether or not someone is able to participate in a clinical trial. And these other costs are also something to ask about if you're interested in a clinical trial or a particular study, to see is there any option for reimbursement. Thank you. That was actually the last question because the other one is similar to what you just mentioned, and so you were able to explain it. So that's it. Okay. Thank you so much, Dr. Rosenthal.
Thank you.
On behalf of MSAA, we would like to thank Bristol Myers Squibb, EMD Serono, Genentech, and Sanofi Genzyme for making this program possible. We would like to once again thank Dr. Rosenthal for the great presentation and Impact Education for their partnership in delivering this program.